Good afternoon. Thank you for joining today's webinar on addressing the needs of veterans in the justice system. My name is Mark Stovall. I'm a policy analyst at the Council of State Governments Justice Center, and I will be moderating today's webinar. For an overview of today's webinar, first we will do introductions of our panelists, then provide some background information on the Bureau of Justice Assistance and the Council of State Governments Justice Center. And then we'll hear from Jessica Blue Howells and Sean Clark about the Veterans Health Administration Justice Outreach Services and connection to other services. And toward the end of the webinar, we'll have time for questions and answers. Joining us on the webinar today, we have Jessica Blue Howells, who is National Coordinator of Healthcare for Reentry Veterans, Sean Clark, National Coordinator for Veterans Justice Outreach, Maria Fryer, Policy Advisor for Substance Abuse and Mental Health at the Bureau of Justice Assistance in the U.S. Department of Justice, and myself, Mark Stovall, Policy Analyst at the Council of State Governments Justice Center. To introduce our speakers, first we have Jessica Blue Howells, who is National Coordinator of Healthcare for Reentry Veterans Program, or HCRV for short, and the Challenge Program, which stands for Community Homeless Assessment, Local Education, and Networking Groups for veterans at the U.S. Department of Veterans Affairs in the Veterans Health Administration. In her role with HCRV, Jessica oversees the VA's National Prison Outreach effort, which has contacted almost 81,000 veterans in approximately 1,000 U.S. state and federal prisons. In her role with Challenge, Jessica oversees national input from over 5,000 veterans and homeless service providers annually about needs among homeless veterans and coordinates data analysis and reporting to help communities identify unmet needs. Next, we have Sean Clark, who is the National Coordinator for Veterans Justice Outreach in the U.S. Department of Veterans Affairs. The Veterans Justice Outreach, or VJO program, provides outreach and linkage to VA services for veterans involved with the front end of the criminal justice system, including law enforcement, courts, and jails. As VJO National Coordinator, Mr. Clark helps guide the program and its 314-member field staff on operational and strategic planning matters. He has been with the VA since 2007 and is a former Presidential Management Fellow. He has also served as a Special Assistant U.S. Attorney in the District of Columbia. And next we have Maria Fryer, who is a Policy Advisor for the U.S. Department of Justice and the Bureau of Justice Assistance, or BJA. She oversees the Justice and Behavioral Health portfolio and collaborates with the Council of State Governments Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of jurisdictions and the people they serve. Maria previously worked in the North Carolina Governor's Office Crime Commission, where she advised the Governor's Office on effectively addressing the needs of victims of violent crime. Maria has also worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for repeat offenders with drug addiction. She has also served in the U.S. Army as a member of the Military Police Corps. Thanks to all of you for joining the webinar today. And just for a few housekeeping items for the webinar, at any time during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address those questions at the end of the webinar. We will do our best to get through as many questions as possible. During the webinar, if you encounter any technical or audio problems, please call WebEx Technical Support at 1-866-229-3239. And please understand that there are some technical issues that you may not be able to resolve during the webinar. For this reason, we are recording the webinar and we will post it to our website at csgjusticecenter.org. We should have the webinar posted online by the end of next week. And now I will turn things over to Maria Fryer to talk a bit about the Bureau of Justice Assistance.
Thank you, Mark, and good afternoon, everyone. As Mark mentioned, my name is Maria Fryer, and I'm a Policy Advisor at the Bureau of Justice Assistance, and I oversee the Substance Abuse and Mental Health Program and Policy work here at BJA alongside our colleagues on this webinar. And at BJA, our mission is to help make American communities safer by strengthening the nation's criminal justice System. BJA's grants, training, and technical assistance and policy development services provide state, local, and tribal governments with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, support law enforcement, and combat victimization. Thank you for joining the webinar on addressing the needs of veterans in the justice system. I'm passionate about this issue because I come from a military family, and as a veteran myself, I am very close and interested in the issue of ensuring that veterans are connected to available services. I will now turn things over to Mark, who will talk more about the Council of State Governments Justice Center.
Thank you, Maria. So now I'm going to give a little bit of background about the Council of State Governments Justice Center. The Justice Center is a national, nonprofit, nonpartisan organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. And on this slide, you can see some examples of the publications we've produced over the years on topics such as justice reinvestment, reentry and employment, school discipline, and behavioral health. And now I will turn things over to Jessica Blue-Howes for the rest of the webinar.
Great, thank you very much, Mark. I just want to double check that people can hear me okay.
Yep, we hear you.
Okay, perfect. Thank you so much. So welcome to everyone who is on the webinar, and thank you so much for having us today. We really appreciate the opportunity to speak with this group, and very much thank you for your interest in serving veterans in your programs. I will be starting off this afternoon, and then we'll turn the call over to Sean Clark, so you'll hear from both of us over the course of the webinar. We do tend to find that questions end up answered as we go through our content, so we will hold those content questions to the end so that we can, refer back to content that we may have discussed as we go through and do some answers. So our objectives for today, we are going to review national estimates of incarcerated veterans. We're going to talk about the components of VA's Veterans Justice programs, work on expanding some awareness of the needs of justice-involved veterans, and then discuss some new developments both in VA and community interventions. And so on this slide, probably the #1 question that we are asked when we're out in the community is how many veterans are involved in the justice system? How many people really are we talking about? And does VA track them? We get that question all the time. What's the number, and does VA track veterans who are involved in the justice system? And the answer is that VA is not the holder of that data. The experts in this field are Department of Justice, Bureau of Justice Statistics, who issued a recent report, Veterans in Prison and Jail, in 2011 and 2012, that was released a couple of years ago, back in 2015. And so the answer to just the overall question, how many are there, is 181,500 veterans were incarcerated in U.S. federal and state prisons and local jails when that survey was completed. And this particular chart is very important for folks who may have been working in this field for a while and who may have been working with veterans involved in the justice system for a while. This really starts to show that we're headed in the right direction. So when the surveys began in the 70s and the early 80s, we really were finding that there were more veterans incarcerated than there were veterans as a portion of the U.S. population. As we start getting, you'll see with that chart, starting to really bend that curve in the 98 survey, the 2004 survey, and then really starting to look better in the 2011-2012 survey. And so here, on this next slide, again, very important to notice what was going on for folks who, again, have worked in criminal justice for a long time. You see that big growth as we headed into the 98 survey, the 2004 survey, really corresponds with growth just across the U.S. in prison populations, but finally starting to see, as we headed into the 90s and then move forward, that veterans are fewer compared to non-veterans in that population per 100,000 residents. So really starting to, again, bend that curve so that veterans are not overrepresented. So what is important to note here as well with these BJS surveys is that they really do indicate veterans are more likely to be men in incarcerated populations compared to non-veterans. They tend to be older than non-veterans. So if you've worked with incarcerated veterans in the past and you work with community incarcerated populations, veterans often are older than folks who you work with in the general population. And as we move into offense type, so this is a piece that has held true over a number of surveys that you'll see, particularly for prisoners, as you would expect, that prisoners cluster around the more serious and the more violent offenses, where jail inmates cluster more around property offenses and drug offenses. What has held true over a number of the BJS reports is that veterans tend to be overrepresented, particularly with violent sexual crimes. We get a lot of questions around why are veterans incarcerated, and this data really sort of show us and paint the picture of what's going on for veterans while they're incarcerated. And it has held true over the last 3 surveys that veterans are more likely than non-veterans to be incarcerated for violent sexual crimes. However, it is very important for us, here we go, as we get to this next slide, to really talk about some context. So for us, when we're working with veterans and responding to any public inquiries with our staff and with us in central office, it can be really easy to fall into language that presumes that veterans are more dangerous or more violent than members of the community who have not served as a result of their military training. And we had the opportunity with our previous director, who has since retired, worked on some new data analyses with the BJS data in partnership with BJS statisticians, and really found this important context that we try and highlight when we're talking to community members. The incarceration rate of veterans is less than half of non-veterans. Really important as we have this discussion. The male violent offender rate is less than that, is less for veterans than for non-veterans. And the data, the BJS data, really do not support the idea that veterans are a more violent population than non-veterans. That's really, really important for us, a component that we really try and keep in mind, especially because it can be easy when we think about this slide, when we think about this data, it can be easy to start talking about violent crimes and forget the context that actually veterans who are incarcerated are less likely to be there for violent crimes. So just important to have in there. Okay, another piece that we talk about quite often and that we really emphasize with our staff, with our partners, with the community, is that risk of homelessness remains very high for men who have been incarcerated. This is a service delivery issue that we try and address within our program and really try and maximize connection to resources that help veterans prevent homelessness if they are exiting incarceration or have faced incarceration. Just a really important planning tool that, even though this particular risk factor data is older, we find that this still really holds true for our population. And then here, for what is federal VA. So this may seem very basic to a lot of folks who are on the webinar, but we always like to mention this. Really important for us to mention who we are as an agency. We find that this is important to review because there are a lot of VAs out there. So depending on where you work, you may have contact with the state, with your local state Department of Veterans Affairs. You may be working with your county Veteran Service Officers. Increasingly in veterans initiatives, we find that mayor's offices and cities have a Veterans Division or a Veterans Affairs Division. And so we think it's important just to understand that when you're working with our programs, with the federal Veterans Justice programs, this is where we're housed. So federal VA includes 3 big main components. The Veterans Health Administration, which is the hospital and healthcare piece, and important to include when you're working with community that VA really thinks of healthcare in a holistic and expansive definition. So when we're talking about healthcare and what's available at VA hospitals and outpatient clinics, it includes physical health, primary care, inpatient and outpatient medical services, surgery, all of the specialty services, as well as mental health care, substance use services, residential treatment, and the big component of homeless services and of compensated work, therapy training, and community employment. So a lot going on there that we consider health. In addition, the Veterans Health Administration includes the vet centers. So a number of folks here may have partnered in the community with the vet centers who have a really unique and important mission to serve veterans in the community, veterans who have seen combat, and to really bring that service delivery to the community using more of a veteran-to-veteran model to really break down big VA to community storefront that's accessible. The piece of federal VA that folks tend to be most familiar with is the Veterans Benefits Administration, which in particular has disability compensation and pension, which tends to be what people really are most familiar with, as well as education, vocational rehabilitation, which are wonderful benefits especially for folks who may be exiting incarceration, getting their careers and their education back on track, as well as life insurance and home loan, which we often find are less well known and sometimes underutilized. And then finally, the National Cemetery Administration, which offers, of course, burial and memorials. We find as well that Cemetery Administration can be a wonderful partner in the community, particularly around jobs and getting back to work. They really have partnered quite well with VA homeless programs on allowing veterans the opportunity to do work training and then move into permanent jobs with National Cemetery Administration. So just want to mention that as to which VA, sort of who we are in terms of which VA we work with. So here are our programs, the Veterans Justice Programs, and our mission is very much to identify justice-involved veterans. As I mentioned earlier in that BJS data, VA doesn't own those veterans. We don't own those facilities. So one of our primary charges is to identify those veterans, really to reach them through outreach. So our programs are community-facing. We always say that we would prefer when we try and call you at your desk that you are not there because you are out in the community, meeting veterans in a jail or in a prison or serving them in a court. The goal, once we've contacted veterans, is really to help folks access VA services as early as possible, and we can only accomplish that through partnerships. So everywhere we go, everywhere VA goes where we're looking to engage with veterans involved in criminal justice, we are guests in those systems. So whether we are looking to sit down with a veteran in a prison or a jail, if our staff are functioning as a treatment team member in a treatment court, or if we are providing education or helping consult around a veteran who may be involved with local police, we are guests, and our staff really in the community work very hard to build and to maintain partnerships. And then our ultimate vision is real recovery that emphasizes maximizing personal success in the community, and at the end of the day, really ending veterans' involvement in criminal justice. So we, in our vision and in our thinking of how this works over time, as our programs become more mature, what we really want is to see an end to veterans' involvement in the criminal justice system. And so here are our strategic goals. VA, of course, has an agency-wide strategic plan and strategic goals. And in the justice programs, we have built some strategic goals that align with that and are really specific to our unique population. So as I just was mentioning with our mission, we really, our key for us is that number one, identifying veterans so that we can provide outreach where they are. Assessing their needs and linking to treatment really mirrors our mission. Combating stigma. So when we think about stigma in the community, I touched on it a little bit in that concept of the BJS data and being sure not to think of veterans as violent veterans or perpetuating that kind of myth. We really try and think about combating stigma as a threefold process. So individually, our staff really work to help veterans address their own self-stigma, any kind of feelings of not being worthy of services or worthy of engagement in treatment. We work internal to our systems with our own providers to be sure that providers don't have fear of veterans who are coming from the justice system. And then externally, we work a lot with community partners and with the media to really have a different narrative than the narrative of veterans being more likely to be involved in criminal justice or more likely to be violent. The last few there, 4, 5, and 6, maximizing efficiency, evaluating our effectiveness, and advancing our knowledge. We have some really strong partnerships with research and quality improvement partners who take a look at especially our internal operations to help us be sure that our models are effective, that we really are reaching veterans, and that we're really working to reach those goals of getting people into VA, really helping them use services that they need. And that final number 7, building capacity through workforce development, we really try to be sure that our staff has very strong training. We offer both orientation to the work when we have new staff, and then really try to help people access clinical training in new models, particularly around motivational engagement and around addressing any kind of mental health or substance abuse issues, that veterans may be working with. And so here, the sequential intercept model is probably extremely familiar to folks on this call, and I would like to highlight that this particular model has been updated by National Institute of Corrections, working with the Justice Involved Veteran Network, have had a really wonderful overlay of the sequential intercept model specifically for veterans, specifically thinking about how veterans can be found in criminal justice and how different kinds of opportunities can be delivered as early as possible. For us, we really are working to pull all of our initiatives from those later intercepts, those intercept 4 and reentry from jails and courts, as early as possible. We really, over time, envision that we see more and more veterans in those early spots, those 3 and 2, hopefully getting into sort of crisis interventions so that we don't have to see them at 4 and 5. And then here is really the operational core. This is what it looks like in the field and what our staff really do. And so I'm going to start on the right-hand side, the prison reentry side, which is the program that I lead. And it looks really, when you line it up, pretty simple. Our staff need to gain access to prisons. They educate veterans groups. They do this in 2 different contexts. So staff, when they are newly engaging a prison and are walking into a facility that has not had any kind of VA outreach before, very often will sit down with the staff, because so many staff members in prisons have their own history of military service and are veterans, to talk through, here's what VA is, here are the benefits that you may qualify for and may want to take advantage of, and here is what I'm trying to deliver to the veterans who are incarcerated and working on reentry. Then identifying veterans, as we talked about, looking at their eligibility for different types of VA services, doing some real one-on-one, sitting down with folks before they release to do some one-on-one reentry work, and then doing follow-up in the community once veterans are released. It's really important to note that even though we have served so many veterans and we have access to so many facilities across the country, the prison outreach staff is the smaller staff in our efforts. So you'll see there that the number of specialists across the country is 44, so small but mighty staff. Quite often, those reentry staff will serve an entire state. So you'll have one person who really serves a very large geography. And in some of the states that have very large numbers of people who are incarcerated, for example, in Florida, California, Texas, Ohio, Pennsylvania, will have multiple staff members who split up the state and really target certain areas and really try and concentrate their efforts in the facilities that have very large number of veterans. What I'm going to do now is turn this over to my colleague Sean Clark to talk about Veterans Justice Outreach.
Okay, and thank you, Jessica. My name is Sean Clark, and I want to start out by thanking our hosts at CSG, and again, just as Jessica did, all of you listening today for your interest in the population that we serve, and for hearing a bit more about the work that we do in VA's justice programs. And so moving on to talk a little bit about Veterans Justice Outreach, or VJO, which you see some of the elements of our program displayed here on the left-hand side of this slide. The first thing you might notice is that there are some significant areas of overlap between VJO and HCRV. And the way that I think it makes sense to think about these 2 programs is actually less as 2 programs and more as one intervention delivered across the different parts of the criminal justice continuum, so across that full sequential intercept model. That's increasingly the way that we're thinking about and talking about VJO and HCRV as one concept that's getting operationalized in ways that look a little bit different because it's happening in different settings. So for example, work that's done in a court setting or a jail setting looking somewhat different from work that happens in a state or federal prison, but with the shared goal of being about identifying veterans in all those places, assessing their needs for treatment, and helping them access that treatment at the earliest possible time. So that, I think, is kind of the unifying theory of veterans justice programs, so to speak, is the way to think about VJO and HCRV. VJO, as Jessica mentioned, it focuses on the earlier phases of the criminal justice process, so those intercepts 1, 2, and 3 on the sequential intercept model. Work that VJO specialists do in jail settings is actually, practically speaking, identical to work that HCRV specialists do in state and federal prisons. That's all about negotiating access to those facilities because, again, we don't have the right to access those facilities on demand. We have to build those partnerships and be able to get in and identify veterans through outreach in those places. And then assessing veterans' individual needs and helping them to plan to access responsive services post-release. And I'll talk in a minute about why the post-release part is so important. Some other elements of VJO that distinguish it from HCRV are the work that VJO specialists do with local law enforcement. This is another element of their three-part role. So the first one is jails, another one is law enforcement. VJO specialists provide outreach and education to local law enforcement agencies about VA resources, about veterans' needs in a broader sense. And a lot of that interaction is really focused on making sure that local law enforcement are aware of VA resources that are available in their community and how they can help veterans get connected to those resources when they might encounter them in crisis situations. For example, if they encounter someone on a call and that encounter is not one that's going to need to end in an arrest, if the veteran is potentially standing to benefit from access to health care services, whether that's mental health care, potentially homeless services, potentially both of those things and more, how does that officer know how to get the veteran connected to those resources quickly and effectively? So that's another aspect of the work of a VJO specialist. And last but not least is the work that they do in court settings. And in most cases, this happens in veterans treatment courts and other veteran-focused courts that employ some version of that model. And I'll talk a little bit more about veterans treatment courts in just a few minutes. That's a model that I'm sure many of you are familiar with. But you see here at the bottom of the slide a little bit about our physical footprint in VJO. As Jessica mentioned, we are the larger of the two programs. We have 314 funded staff across the country. Every VA medical center is required to have at least one VJO specialist on staff. Many now have more than one as VA's involvement with veterans treatment courts and with other criminal justice partnerships as that has grown over the past several years. The number of VJO specialists at our medical centers is often 2, 3, 4, or in a couple of cases, 5 specialists operating out of a single facility. So if you think of the nearest VA medical center to you, maybe there's one in your community or one nearby, know that there is at least one individual who's focused specifically on working with veterans in these justice settings. A word just briefly about something that we'll come back to later. We do have in the slides a way for you to know how to contact the field staff in both of these programs who are close to you. So Jessica and I are going to continue to talk about what these programs are about and what we're trying to accomplish in a broad sense. But in both HCRV and VJO, a lot of the way the work looks is dependent on the realities of the local criminal justice system. And as I'm sure many of you are aware, there are tremendous variations in the ways that local courts operate, the rules that they're required to operate under, also likewise local jails and certainly prisons as well. This work can look very different in different communities, and so it's important, I would argue, to get a real sense of what this work looks like in your community. And a great first step to take for doing that is to reach out to the HCRV and the VJO staff who are working in your area and who've built these relationships and are doing this work. So we'll come back to that. That is a resource that we will get back to. As Jessica mentioned in talking about our mission statement, outreach that is done in VJO and HCRV, of course, is not done for its own sake. The purpose of all of it is to find veterans who have needs for treatment and to get them linked to that treatment as quickly and as effectively as possible. So how's that going? What do we know about how that's working out so far? We've got here summarized some of the results of work done by a VA researcher on the veteran population served by the VJO and the HCRV programs and their use of VA services after they are contacted through outreach. I won't read this to you verbatim, but what you see here in the first bullet is really about the prevalence of need in the population that's served by these two programs. And the simplest thing to say is that level of need is extremely high. The veterans who we serve in VJO and HCRV have very high rates of mental health and substance use disorders, and you see the specific figures laid out here. And the one figure that I'll highlight for you is that in VJO, most of the veterans who we serve in this program end up dually diagnosed. So when they connect to VA healthcare, they receive both a mental health and a substance use disorder diagnosis. So that gives you a sense of of course, the overall level of need, but also the clinical complexity of the individual veterans that we're serving through these programs. They don't need one thing oftentimes. They need access to many different services to fully address their needs. VA is in a good position to do that because, as Jessica mentioned, we offer a wide variety of treatment services and other resources. But it's a clinically complex population with a lot of unmet need. The second and third bullets are about access to care. This is sort of the point of the outreach that we're doing through these programs, is getting veterans access to these services, and fortunately that is happening. So within a year of their outreach visit with VJO, as you see here, the overwhelming majority of veterans who had a mental health diagnosis accessed responsive services, and about 80% were what we call engaged with mental health services. And so that's measured as having had at least 6 visits over that period of time. So this ongoing involvement with treatment. And then the figures here in the third bullet speaking to the rates of access to substance use disorder as well. So we think this is a good indication of the value that these programs are delivering. We're going out into these justice system settings. We're finding the veterans who have these significant needs and helping them to access the services that are responsive to them. So in short, they're getting from point A to point B, which is the basic test of the effectiveness of an outreach program like ours. Speaking of VA treatment, I want to say a word about the most significant limitation on what VA can do for justice-involved veterans, and that's this. While a veteran is incarcerated anywhere, whether that's in a local jail or a state or a federal prison, VA can't provide health care for that veteran. Whoever is holding the individual, so whether it's the prison or a jail, has the duty to treat him or her, to meet his or her medical needs. So as a result of the regulation that you see here on the screen, that veteran is ineligible for VA health care while he or she is incarcerated in that facility. So that has shaped both of these programs from the very beginning of their existence. That's why the focus of our outreach is on identifying the unmet needs for those veterans and working with them to plan how to access those services after they release. Because we're not able to send VA clinicians into these facilities, we're not able to ship medications to these facilities, and to deliver those services while that's the responsibility of the prison or the jail. I will say there is a small exception to this rule, and it's small, but it's very important for the veterans that it affects. Veterans in halfway houses, also, or these may be known as residential reentry centers, work release facilities, or the equivalent, they are, while they are still considered inmates, for VA purposes, they are eligible for VA healthcare. Once they release into a facility like that, and they're in that sort of transitional setting, veterans are eligible for VA healthcare, and that is written into this regulation. You don't see it here on the screen, but there is a provision that says that those veterans are eligible for VA healthcare. That was done because VA understood that veterans, as a condition of getting into those programs, often had to waive their access to health care, whether that's provided by Bureau of Prisons or by a state agency. They often have to waive their access to health care in order to get access to a work release opportunity or to enter a residential reentry center. So to avoid having those veterans fall between the cracks and miss an opportunity to access care that they need at an important transitional time, those veterans are eligible for VA health care despite still being in custody. But this is an issue that comes up quite a bit. We get questions about this all the time, in particular from often smaller communities with jail facilities that may have limited resources, limited medical capabilities in their jails, wondering whether VA can provide treatment of one type or another for an inmate who's a veteran, and the answer is no, as a result of this regulation right here. So this is the limitation that we really shape our interventions around. Coming back to Veterans Treatment Courts, to the extent that folks are familiar with the VJO program, odds are it's because of the work that we do in Veterans Treatment Courts. It is by far the most visible work that the program does, and these are courts that are spreading so rapidly across the country and have been for the past several years. They are, and I'm sure many of you are very familiar with this concept, but just very briefly, the concept behind a Veterans Treatment Court is an extension of the model that originated with drug courts in the late 80s and was extended to mental health courts in the 90s. What we see now are Veterans Treatment Courts that take elements from both of those models and tailor it specifically to work with the veteran defendant population and add a couple of new specific elements. One is volunteer veteran mentors, and so this is an important component of what it means to be a Veterans Treatment Court. These are, as the name suggests, they're volunteer veterans from the communities where these courts operate, and they provide non-clinical support for the veteran defendants who are going through Veterans Treatment Courts. They don't work for the court, they don't work for the VA, they're volunteers, and they connect with the veteran participants one-on-one, support them through what's often a long process of getting through one of these treatment courts. The Veterans Treatment Court model as we know it today originated in Buffalo, New York in 2008, and it is a collaborative approach. For those of you who may not be as familiar with the model, it is unlike the traditional criminal justice process. It is non-adversarial, and both the prosecution and the defense share the goal once someone is in a Veterans Treatment Court of getting him or her connected to the treatment that's going to address any underlying clinical issues, and also connecting with resources that can help address other barriers to employment, to stability, to success, to avoiding coming back into the criminal justice system, broadly speaking. So what do VJOs do in these courts? VJO specialists are members of the treatment team, along with the prosecutor, defense counsel, probation, the court coordinator, and their role is as a liaison between the VA healthcare system, and specifically the VA facility where that individual specialist works, and the court. So what the specialist does is help facilitate access to VA treatments for the veterans who are going through that court, and then over time, with the veteran's permission, they're able to share information and provide visibility to the judge and the other members of the team on how it's going, how the veteran is engaging with their VA treatment, and what sort of progress is being made, so that the judge can use that information to determine the next steps and how the case progresses as that veteran works hopefully toward graduating from the program, potentially having the original charge dismissed, or at least having the opportunity to avoid incarceration or whatever the traditional sanction for that offense would have been. Just a brief visual, sort of to give you a quick visual sense of where Veterans Treatment Courts are at this point. All over is the short answer. They are now in, I believe it's 47 states at this point. And as you see here, they are thick on the ground. We have identified over 400 Veterans Treatment Courts and other veteran-focused courts all over the United States. So I mentioned earlier, this model is now only 10 years old, and it has spread all across the country. So a sign that this really has legs and is taking the country by storm, so to speak. So I'm going to talk now about a few recent developments within VA and also in the broader community that are relevant to the justice-involved veteran population. I'm going to start with a brief detour into civil legal issues, and it's really not a detour, at least in our world, because so many of the veterans who we see in VJO, who by definition have criminal justice issues going on, also have unmet needs for civil legal services. And so the challenge survey that Jessica oversees, every year VA uses that to identify homeless veterans' unmet needs. And try and see how responsive the services that VA offers are to meeting those needs. Over the past several years, the top 10 list of unmet needs for homeless veterans as identified by homeless veterans who respond to the survey, that list has been dominated by needs for legal services. So the needs for legal services to address child support matters, to address evictions or foreclosures, and other civil legal issues. VA can't provide legal services directly. We don't have the legal authority to do that or the staff resources to do that. We don't have thousands of attorneys in order to provide legal services to veterans directly. So what we've done in response to that limitation, but also to our awareness of this need in our population, is to partner with legal service providers across the country and to bring them into our medical facilities to offer free legal clinics to veterans who are there receiving care. So we've now got, as you see here, over 160 free legal clinics operating in VA facilities all over the country. So these are VA medical centers, the main hospital facilities, smaller outpatient clinics, and also vet centers, as Jessica was talking about earlier, those smaller storefront operations separate from our medical facilities that are located out in the community. There are legal clinics operating there as well. And the intent there is really to help veterans access those services that are responsive to those needs, even though we can't deliver those services ourselves. But again, the power of partnerships, which really defines all of our work in these programs. There is one VA homeless program that allows grantees to pay for legal services for homeless veterans when that's directly related to their ability to get into or to stay in permanent housing. That's the Supportive Services for Veteran Families program. But that's one program among many. And of course, most veterans who are receiving services through the VA homeless programs aren't in SSVF. So these are potential resources for everyone else, so many of whom have these unmet needs for legal services. Next, let's see. I talked about, and Jessica did as well, the fairly limited number of staff that we have when you think about the overall context and you think about the size and the scope of the criminal justice system and the number of justice-involved veterans all over the country. So between the two programs, we've got about 350 staff doing outreach all through the U.S. And that means that our staff can't be everywhere at once. We can't have a physical presence in every prison and jail facility all the time. So what we've developed over the past couple of years are a couple of video resources that are effectively extenders for our staff, or that can serve to plant the seed with justice-involved veterans that may want to follow up and find out more about VA resources that may be available to them. The first one here, A Second Chance, is a basic overview of both the VJO and the HCRV program. It's about 20 minutes long. The second is called Suits, and this is a 4-minute video, very short, very succinct, and it's intended to be shown inside prison and jail facilities, and it speaks directly to incarcerated veterans. And so both of these videos are available on our program website, and you see the address here. I'd encourage you to check those out if you have a chance. We have shipped thousands of copies of Suits in particular to the state and federal prisons and to many local jails as well, trying to get the word out that VA wants to be of service to justice-involved veterans, again, even where our staff can't be there physically all the time to deliver that message. We're trying to extend their reach with resources like this. So again, if you get a chance, please take a look at those and feel free to use them in any way that might be helpful to you. Our outreach staff certainly do. They incorporate elements of those into presentations they give in the community. Here's a tool, a VA-developed tool that is, we think, one that has tremendous potential for identifying justice-involved veterans in a variety of settings. The Veterans Reentry Search Service. This is a web-based tool that VA's developed that allows prison, jail, and court staff to identify veterans in their system. How this works in a nutshell is that the prison, jail, or court staff member visits, logs in to the VRSS website, which is encrypted, and they send a secure upload of their inmate or defendant data to VRSS. In about 2 hours, they get back a list of results that shows which of those individuals have a record of military service. And that's all it does. It can only verify that there is a record of military service for that person or not. It can't speak to eligibility for VA healthcare or other VA benefits. It can't do anything beyond that, but it's useful as a first step just for identifying who the individuals are in a given setting that may be eligible potentially for VA services or other VA benefits. We're encouraged by some of the results when this system gets used. One example here, or the second bullet under status that you see, is that VRSS identifies roughly 8% of the inmate populations that it checks. It finds a record of military service for those individuals. Self-report, which is typically the method that is most commonly used to identify veterans in justice settings, has its limitations. It relies on an individual's willingness to answer that question and to disclose that they served in the military. So one example I'll give is the California Department of Corrections, which has a huge inmate population, well over 100,000 individuals. Using self-report, they had identified between 2 and 3% of their population as having served in the military. They ran their population through the RSS and found it was about 7.5%. So given the size of that population, that's about 5,000 veterans in that gap who hadn't been identified previously but now were. They were known to the California Department of Corrections as having served, and they're also known to our outreach staff who are then able to follow up on that information and to work with those individuals. So VRSS, we think, is a very promising tool and one that we're trying to get used as broadly as possible to identify veterans in justice settings. This development is not a VA initiative, but it's one that we're excited by and glad to be a part of wherever we can. And this is the development of veteran-specific units in prisons and jails, often known as veterans dorms. And you see here there are a variety of reasons that prison and jail administrations pursue this option and want to develop these programs. They can be a very effective vehicle for delivering services to veterans. So VA is far from the only institution conducting outreach in these facilities. It is an opportunity for the facility itself to deliver veteran-specific programming and opportunities to that population. And also anecdotally, we hear from facilities that take this approach that these tend to be the units that they don't have disciplinary problems with. They tend to be units where corrections officers want to work, volunteer to work. Oftentimes those are veterans themselves. And it tends to have just a positive effect overall on the facilities where they're located. There's no formal evaluation that we're aware of these programs yet, so it's too soon to say that they definitely save money, reduce negative outcomes, and back that up with research, although we're sure that will come over time. But this is, like the Veterans Treatment Courts, this is a model that is growing, and as of last fall, we were aware of over 80 of these programs in federal, state, and local facilities. So a trend that we'll hopefully see continue. And here, just a quick visual representation, as we did with the courts, of where these units that we're aware of are located and how they're concentrated in the different states. Okay, that takes me, I think, to the end of what I was going to cover, so I'll pause there and hand the mic back over to Mark for the next part of our discussion.
Great, thank you so much, Sean, and to Jessica for your overviews and for that really helpful information. So now we have a few minutes for questions and answers, and we have a few questions that have come in already, and feel free to continue chatting your questions into the chat pane in the bottom right-hand portion of your screen. So one question we have, first off, is what type of benefits can be provided to veterans who do not have an honorable discharge? Maybe Jessica, do you want to start?
Sure, this is Jessica. I can get started. So something that we really emphasize when our staff are out in the community is being sure that veterans apply, particularly for VA healthcare, even if the veteran thinks that they may not qualify. The reason that we really emphasize that is that Congress adds to and changes and expands eligibility all the time. So every legislative session, Congress adds communities of veterans who are newly eligible, particularly for healthcare. So we always encourage people to apply, even if folks in the past may have been determined not eligible, maybe because they had an other than honorable discharge, maybe a bad conduct discharge. There are sometimes vehicles to help those veterans become eligible for healthcare. We also, there are two kind of major initiatives that may be helpful for this population. There recently has been, using existing legislative authority, the opportunity for VA to provide mental health services on a short-term basis, particularly for veterans who are in crisis, even if they otherwise would not qualify for VA full health care benefits. So that's really important, that if you're working with a veteran who is in mental health crisis, there are some new opportunities. It's short-term, but does help a veteran get access to full mental health and psychiatric care if that's what their need is. And then the other piece, Sean had mentioned a program called SSVS, Supportive Service for Veteran Families. There are other homeless programs. There's a program called Grant and Per Diem that offers transitional housing. There's also the Healthcare for Homeless Veterans program that offers housing via a contract mechanism. All three of those programs have expanded definitions of veteran. They're authorized in different legislation than the core medical benefits package. And so there are some expanded opportunities for veterans who might not qualify for full health care benefits to potentially qualify for homeless prevention services or for short-term or kind of mid-term transitional housing services. Sean, anything I missed there?
No, that's very thorough.
Great, thank you, Jessica. And then another question is, what is our option if the VJO is 4 hours away and is too busy to provide reentry services to our veterans at our local jail? Sean, do you want to take that one?
So that is a reality of the limited number of staff that we have and the catchment areas that our VJO staff have to cover. They are not able to serve facilities that are located large distances away from where they're based in the same way that they're able to serve those that are in their communities or close by. So what I'd encourage you to do in those circumstances is to make contact, if you haven't already, with the VJO specialist at the facility that that covers your area, even if it's quite a distance away, and to pose that question and to say, how can we work together? What is available to the veterans who I'm seeing in this community, recognizing that you're not here, you, the VJO, aren't here physically doing outreach. What can we put together? And how can we think this through in a way that results in veterans who get identified at this long distance from the main medical center that still results in them getting access to the VA services that they need. And that can take a variety of different shapes. If there are outpatient clinics that are located close by, other satellite facilities that aren't the main medical center but that may be located nearer than a 4-hour drive away, that may present some options for veterans to get primary care, mental health services, other services as well. But the particulars will depend on your local community and that process of thinking it through with the VJO specialist. That is a challenge, and it's not one that we're, with our staff based at our facilities and having to sort of hub out of them, that is, it is a problem-solving challenge to have to figure out, what does that mean for the veteran who's located, a long distance away. It's the same challenge really faced for those veterans who aren't justice involved, who are located at that kind of remove. But for the justice involved veterans specifically, that's part of what the VJO specialists are in the business of needing to figure out. What kind of services can we provide meaningfully for veterans who are at the outer reaches of our catchment area, and that we can't have a daily or even a regular physical presence in. So I'd encourage you to reach out and sort of start that conversation.
Thanks, Sean. And then there were a few questions about veterans treatment courts. And so one is, do you have any suggestions on convincing local government that a veterans treatment court is a good thing? It doesn't seem like they understand the need for veteran services set apart from the general public.
Well, I think, the first step in figuring out whether it makes sense for a community to start a veterans treatment court or some variation of that really is identifying the veteran population that's passing through the local criminal justice system. And so this is not something, our orientation as the VJO program is not that every community in the country needs its own veterans treatment court. We want to hold ourselves available for partnership with communities in whatever form that takes in the criminal justice system. And so if there is a community that maybe because of a smaller population or a smaller concentration of veterans wants to do something to identify justice-involved veterans and connect them to services, but based on low numbers or low frequency, it's not enough to justify starting a veterans treatment court locally and putting resources into that. There are several options that there are precedents for across the country. One of them is going to a regional model where defendants have their cases supervised by the existing veterans treatment courts in other jurisdictions. So if your county doesn't have a veterans treatment court, maybe the next county over does, and it's possible in some of these cases to have that case transferred and supervised there, so that the veteran still has that opportunity. So that's one thought, but that's by no means the only possibility. So I would say the first step is figuring out, what the need is, what the numbers are of justice-involved veterans going through your local justice system, and I'll put in a plug for VRSS here. That's a great resource for figuring that out and for getting a handle on the size of that population. But then after that, starting a new Veterans Treatment Court may or may not make sense, and that is that's a local decision that's made within the court system, and we try and partner with the courts and help them enact whatever decision makes the most sense to them locally.
Thanks, Sean. And then another related question is, so if a Veterans Treatment Court is being put together by a community, does it need to involve the VA?
Yes. And so that's one of the key components of the Veterans Treatment Court model, is access to VA healthcare for participants. So there are, if you look at the 461 Veterans Treatment Courts and other related court programs across the country, you will see a lot of variation in the way that they're organized, and that reflects the way that different local justice systems are organized, and a lot of other factors. But access to VA healthcare is a feature of all of those courts. And so, one point of distinction among these courts is that some will limit eligibility only to veterans who are eligible for VA healthcare. Others will admit veterans, both who are eligible and veterans who aren't. And then it becomes a task of identifying community resources for those veterans to access if they're not able to get services through VA. But just as a definitional question, the way that the model has been established, VA healthcare is a key component of what it means to be a VTC.
Thanks, Sean. And another question is, how does our local jail get access to the VA DoD identity repository?
Sure. So the identity repository is the source material for Veterans Reentry Search Service, or VRSS. That's the name of the system. And please feel free to direct them straight to me for that if there are questions. My contact information is available later on in our slides. I'm always happy to hear from a jail or a court, prisons as well, that want to use VRSS.
Great, thanks so much. Another question is, does the VA offer any programs in the domiciliary programs for people who are returning from incarceration? Maybe Jessica, do you want to take that one?
Sure, this is Jessica. And so what we see is that there are actually a number of VA medical centers, which is in VHA, where the domiciliaries are organized. A DOM, for folks who may not be familiar with that terminology, is a VA residential program, so not a grant program, but a direct VA residential program that delivers intensive services across a number of issues. So there are substance abuse programs, PTSD programs, other mental health programs, there are homeless domiciliaries, and there are a number of VA medical centers that partner very closely, particularly with people returning from prison, to have veterans start their treatment in residence in one of the VA domiciliaries. So it is not, we don't have a specific domiciliary program for veterans who are returning from prison and jail, but if a veteran has a clinical need, they would be able to use that resource.
Thank you, Jessica. Another question we have is, does the VA have any programs to assist veterans who are registered sex offenders? And Jessica, do you want to take that one?
Sure, yeah, and I can start, and then Sean, if there are pieces that I missed, please do fill in. So what VA has is access to, for veterans who qualify for VA healthcare, access to the full array of mental health or substance use services, physical health services that veterans may need. It's pretty rare in the VA system that we have psychologists or psychiatrists who are specifically trained in sex offender treatment, and we have not come across, in all of our years of work, we have not come across VA programming that meets state standards for sex offender treatment. So veterans can come to VA and receive all of their supporting physical health, mental health, substance use treatment, but often need to actually do their sex offender treatment using a community resource.
And just to tackle kind of a related question to that really quickly, the issue comes up quite a bit also of just access to VA services more broadly for veterans who are sex offenders, so not sex offender specific services, but eligibility for VA healthcare generally, and for specific programs for veterans who are registered. And there's very clear policy guidance on this, that VA as a healthcare system treats veterans who are registered sex offenders in the same way that it does veterans who aren't. They're eligible on an equal basis, and they're to have access to the programs that they're clinically eligible for, just as they would if they weren't required to register. So that's a message that our system tries on a regular basis to send all around, and just so everybody knows, being registered does not affect your eligibility for VA healthcare. And once you're in the VA healthcare system, being registered shouldn't have any impact on the way that you were served. So that's always a message that we like to emphasize, that does not have that impact, sort of separate from the question of offender-specific treatment services.
Thank you both. And then one last question that we'll cover on the webinar is how can I find out which jails or prisons in my jurisdiction have veterans dorms? So Sean, I think in reference to that map that you showed on the last slide, is it possible to find out where exactly those jails or prisons are?
Yes, and I think the best way to do that is to write us. I don't think there's a separate resource where those are listed, beyond just our identification of them. So feel free to drop us a line, and we'd be happy to let you know where they are.
Great. And then on this slide here, you can see contact information for Sean and Jessica, and also a link to local staff for both the VJO and the HCRB. And contact information for Justice Center staff as well. But I want to thank all of you, Jessica, Sean, and Maria, for being on the webinar today. And just on the next slide, we have a link to the Justice Center newsletter subscription page. So you can follow that link and sign up for our newsletters to get announcements about future webinars and other resources. Thank you all so much for joining the webinar today, and we will post the recording of this by the end of next week.